it unforgettable. As you walk, picture that banner on the first house being pulled by 30 tiny babies dressed as superheroes. That's IMR 30. At the next house, the mother celebrating 100% health is holding a giant glowing number 100 made of light, MMR 100. The sign for family size is shaped like a big 2 with a tiny child climbing on a 0.1 at the top, total fertility rate. Now let's picture those diseases on large billboards. Malaria and Japanese encephalitis targets are both half covered by black shadows, showing there to be reduced by 50%. Kala Azar is shown as a completely empty frame for 0 deaths. The TB billboard has a huge green checkmark next to an 85%, representing the cure rate. For cataract, visualize a giant auditorium filled with 46 lakh people. And the leprosy billboard has a magnifying glass focusing on one tiny dot against 10,000 background dots. Now as you move past these, you enter a small clinic where an ASHA worker is helping a woman. A counter nearby has a digital display flashing 2,50,000 strong to remember the number of workers. Start your visualization by mentally walking into a primary health center or PHC where you see clean, well-equipped rooms for good hospital care, leading to a side room marked with institutional deliveries welcome. From there, you spot a village where a trained community worker is showing everyone how to build household toilets for better sanitation. Outside on the road, you notice a mobile medical unit with district outreach on the side. Finally, picture a local Anganwadi where there's a sign that reads UIP Day, representing the Universal Immunization Program, and where checkups happen for expectant mothers and their newborns. By the door, there's a notice about joining community health insurance. Imagine a village where a trained community worker is the first person you meet, carrying a drug kit for generic ailments. She leads you to a clinic where they provide good hospital care with signs for institutional deliveries and a universal immunization program or UIP. Nearby, there's an Anganwadi with a calendar marked Health Day where someone is showing how to build household toilets. Outside, a mobile medical unit waits and a notice promotes community health insurance. Okay, quick revision time. For the national level, picture that banner with 30 tiny superhero babies representing IMR 30. Nearby, a radiant mother holds a glowing 100, meaning MMR 100. Their target family size is precisely 2.1. All disease targets are half shadowed for a 50% reduction, except Kala Azar, which is completely empty for 0 deaths, and TB with a huge green checkmark for an 85% cure rate. Cataract pack an auditorium with 46 lakh people, and leprosy prevalence is almost invisible. Now at the community level, picture that ASHA worker with her drug kit at an village health gathering. The primary health center nearby provides care and has a section for institutional deliveries. Village sanitation is improving with household toilets, a mobile medical unit roams the district, and everyone learns about universal immunization and community health insurance. Hopefully that summary solidifies those key points for you.
Now that we have discussed about how to remember NRHM and its goals, national level and community level, let's quickly revise whatever given in the book. IMR decreased to 1030 out of 1000, MMR decreased to 100 out of 1 lakh, that is 100 by 100k, and total fertility rate decreased to 2.1. Malaria mortality rate reduction 50% by 2010, additional 10% by 2012, and as well as dengue being 50%, and JE, that is Japanese encephalitis 50% by 2010. Filarial rate reduction 70% in 2010, 80% in 2012, elimination by 2015. Kala Azar 100%. Kala Azar mortality rate reduction by 100%, that is 0 deaths by 2010. And now cataract operation increased to 46 lakhs per year in 2012. Leprosy prevalence rate reduced from 1.8 is to 10,000. 1.8 is to 10,000 in 2005 to less than 1 in 10k. Leprosy, that is 1 in 10k. TB dot service 85% cure rate, upgrading CHC to Indian public health standard, increase utilization of first referral units from less than 20% to 75%, engaging 250,000 females ASHA in 10 states. Community level goals to be achieved. PHC, CHC should provide a good hospital care, then generic drugs at sub-center level, access to universal immunization program, facilities for institutional delivery, community level workers at village, health day at Anganwadi should provide immunization, antenatal, postnatal checkups, provision of household toilets, improved outreach services through mobile medical unit at district level, community health insurance. So these are the goals to be achieved in NRHM.